Hi YouTube, welcome back to my channel. My name is chene.monique, and if you have been following me, you know that I am documenting my plastic surgery journey. This is the third and final video of my journey. The first two were all about boobs and facial fillers, and this last one is all about butt. So I am talking about a Brazilian butt lift, or in other words, sometimes you hear it called a BBL. Of course, Drake has talked about it millions of times. A Brazilian butt lift is what it means. The definition behind a Brazilian butt lift is the practice of your doctor removing fat from unwanted places via liposuction and then transferring it to areas that you do want fat. So areas like your thighs if you want bigger thighs, to your butt if you want a bigger butt, to your hips, to your boobs, wherever you want more volume, you can transfer this fat. What your doctor does is he takes out the unwanted fat and then he harvests all the good, healthy, really good cells and fat and re-injects it. So that is the process of liposuction. It is two procedures: liposuction and then re-injection. So when you think of this procedure and people think, oh, they're just putting something in the butt. Yes, it does have to do with your butt, but it also can have to do with other areas on the body, and also it's just not one procedure. You are undergoing liposuction, the removal of the fat, and then you're also doing fat grafting, putting the fat back into areas. So it is a huge procedure. It is something that you definitely don't want to take lightly, and we will go into that into this video. So let's go ahead and move into why I wanted to get a BBL. After having two kids, my body has never been the same. Obviously that kind of sounds a little like pretentious, like, oh girl, you expected your body to look the same after two kids. No, not at all, but I just wasn't feeling good about myself. My confidence was low. Buying clothes I didn't really ever want to do because buying jeans was like a nightmare. I would have fat hanging over my jeans, or it just wasn't a fun experience. I would look in the mirror and I'd be like, oh my gosh, look at all that fat around my stomach. My butt didn't even stick out. It just wasn't a good feeling for me personally, especially knowing what my body looked like pre-kids. It's kind of just like one of those things I was like, I really want to do something for myself. And obviously I'm not new to plastic surgery, so that definitely was something that I wanted to research. Of course, people are gonna say, well, hey Shanae, you could have went to the gym, lost the weight, built a booty with lunges, squats, all that. I've heard it all before, trust me. And I'm just gonna touch on that very briefly. Basically, you do what you wanna do. Don't knock somebody for doing something that they want to do just because in your eyes you don't feel that it's right. Of course I could have went to the gym and lost the fat. Of course I could have done it the healthy way, but I just particularly don't like to work out. I don't have the motivation to work out, honestly, and it just isn't for me. And I had the money, I had the solution, and I went and got the result. So that is that on that situation. I'm not opposed to women that believe in being all natural, and I'm not opposed to women that want to get some work done. We all are our own bosses, we all pay our own bills, and we all live our own life, and we all answer to one person, and that's God and nobody else. So moving on. So now that I let you know about why I wanted to get a BBL, I'm going to move on to how I researched it. I would see a lot of girls on Instagram with these perfect bodies, and I would be like, oh my gosh, like how are their waists so small and their butts so big? I also have a lot of people that I know that have had this procedure done that have opened up to me and let me know about the procedure. So I went ahead and went online and looked up the procedure. A really good website and tool for a BBL, Brazilian butt lift, site and to do research on is realself.com. So realself.com. realself.com is a great website to research and find doctors. So that's where I found my first doctor. But before going into my first choice doctor, I also did some phone calls to some of the doctors my friends went to and some doctors here in the United States. So my first phone call was to Dr. Sej Patel in Beverly Hills. I'm sure so many of you guys have heard of him. He is a very, very popular doctor on Instagram. He hashtags shaped extra juicy, and you see a lot of his work, and it's beautiful work. Now, when I reached out to him, because he is in my home state of California, I was really hoping to go with him just because it would be a 45-minute flight. I would be here in California, and it's Beverly Hills, like it's luxury. So when I got a quote from him, I was not expecting the price. I got a quote from him about a year and a half prior to getting this quote, and his quote a year and a half ago was $13,000. That quote was good for up to a year. At that point in time in my life, I wasn't sure if I wanted to get a BBL, and so fast forward to a year and a half later, I reached out when I was ready to get a quote, since it had been past a year and that $13,000 was no longer good. They told me $25,000. How do you go from $13,000 to $25,000 in a span of 18 months? Like, that's fucking ridiculous. Like, $13,000 was already ridiculous a year and a half ago, but it is Beverly Hills and it is a Instagram famous doctor. But what do you do that is so amazing that warrants you to charge your patients $25,000? And I'm so sorry to people that are spending that kind of money on plastic surgery, but there's no way in hell I'm paying $25,000 on a procedure that is not permanent and that is not going to make me out of gold. Like, are you putting gold in my ass? Because if you're not, I'm not paying $25,000. So I quickly got off track from that. And then of course there's other doctors that I researched here in California, and I did not find anything that was under 10 grand here in California. And yes, 10 grand is a good reasonable amount for plastic surgery. You also have to understand the results. The plastic surgeons in California and in a lot of cases in the United States do not give the best results. They do remove a good amount of fat, but you don't get that really snatched waist, or you don't get that big, round, nice, juicy booty. The doctors in the United States or in California are very, very conservative. So I don't see the point in paying 10 grand and up for something that is just like a little here. No, I want that boom factor. So that was out of the question. Moving on, I then went back to realself.com, and I started seeing these girls that look like Barbie dolls, like literally this big of waist and these big round booties, and I was just like, where in the hell did you go? Come to find out, they were leaving the country for surgery. So a lot of the girls that I really liked were going to a doctor named Dr. Cabral in Santo Domingo, Dominican Republic. Now, if you don't know where that is out of the country. That is basically the country that's connected with Haiti, I believe. I hope. I seen it on the news this week for the hurricane, so I hope I'm right. But it is out of the country, and it's south of Florida. It's an island south of Florida. And so I've never been there. But I was like, I love the way these girls looked. So I contacted him and I got a quote from him. Within less than 24 hours, he let me know his price was $3,800 cash American, and that I would be able to get with him October 3rd. So he gave me a surgery date and he gave me the amount, and he let me know prior to surgery, the date, he would give me some more information. So I was super excited. That was my doctor, $3,800. I'm ready to go. And mind you, the $3,800 is strictly for the surgery. I'm not going to get into that because I ended up not going with him. But when you travel outside of the country, you want to make sure that you understand that you are paying for solely the surgery. You're not paying for your medicine, you're not paying for your labs, you're not paying for your basically anything else, your room stay. Everything else is an additional cost. So factor that into your price. Going out of the country. Okay. Hold on. More research found on. Okay, sorry. I'm looking down at my notes. So when you are going out of the country for surgery, basically once I got my information from the doctor and I was excited, ready to go, I told my mom. And that's when reality struck. My mom basically told me that if I left to go out of the country to get this surgery and go to Dr. Cabral, she wanted me to sign over a power of attorney of my kids because she told me I was going to die. She was that afraid for me, for my life, and we had an in-depth conversation about it, and she really shed some light on the situation for me, and I came to the conclusion that I no longer wanted to travel abroad for surgery. And I'm just gonna get a little in depth with why, but I'm not going to go 100% into it because I know a lot of women that do desire to go to Dr. Cabral or do desire to go out of the country, and I know a lot of girls that have, and they look great and they feel great. But this is my own personal opinion. When you go out of the country, you have to understand that you are in a whole nother territory. They don't speak the same language. They don't share the same money or currency that we have. You need a passport to leave the country. You need a passport to re-enter the country. They have different laws, different regulations when it comes to practice of medicine. Your body is not immune to a lot of the things that are in those countries because, again, they have different laws on immunizations. They have different laws on sterilization. Who knows if you're going to come back with a virus that your body is not prepared to defend. And also, it's a country that has a lot going on, and a lot of foreign countries do right now, just like the United States. So it just wasn't something that I was willing to put my life on the line for, and the pros just didn't outweigh the cons for me. So I didn't decide to go with him. Now, am I saying that the United States doctors are the best doctors in the whole wide world? Absolutely not. I literally have seen some of the best work come from different countries. So when choosing a doctor, just make sure you do your research and make sure you feel 100% comfortable with knowing the outcome of if you go. Just like there's risks in the United States, there are risks outside of the United States. So say if anything was to go wrong, you're not in your home country. Your family is 1,000+ miles away, and to me that just was not the choice for me. If it is, I wish you nothing but the best. And I just pray that everything goes right, and that's just with any surgery. So moving on from that, now that I don't have a doctor, I went back to the drawing board and I went back to realself.com and I started doing some more research, and I started to see some more dolls that I really liked, and I found my doctor, Dr. Hasan. And let me go ahead and pull up his information. So Dr. Hasan is actually out of Vanity Cosmetics in Miami, Florida. When I talked with him, he did let me know that he was from San Francisco, California. So he is a fellow Californian. I am from California, so that was good to know about him. He's been doing this particular procedure for over 17 years. And a lot of people ask me, you know, aren't you afraid that your doctor has a prior death on his record? And again, I'm going to be very clear and straightforward with the situation. My doctor does have a death on his name. The woman that died from having a BBL with my doctor was in her 50s, and I don't want to talk too much about the situation because I don't know her family, and you know, you know, it's a sensitive subject. Someone did pass away. But what I do know is the woman that got the procedure, she was higher up in age, and the information that she gave to Dr. Hasan about her health was incorrect. She wasn't in the best health to be having this surgery, and he was unaware of her prior health conditions, and she did pass away from an embolism, which is basically a blood clot that travels to your lungs or your heart or anything like that. So she did pass away. Now, Dr. Hasan was not charged with any malpractice. He was not charged with this death. He was not found guilty of any wrongdoing in this situation. And out of the thousands and thousands and thousands of BBLs and plastic surgery that Dr. Hasan has done, he has only one death under his belt. And that does happen in surgery. That is the risks. No risk is 100% proof. Things go wrong. But does my doctor wake up in the morning and say, hey, I want to go to work and kill my patients today? Absolutely not. I'm sure he's just as much as troubled with this situation, just like any other doctor would be, because that's his reputation. He is a very educated, a very humble, a very smart man, and I'm sure he's just as much devastated, but in all actuality, it wasn't his fault. So that's all I'm gonna say on that subject. I had surgery with him, and I'm fine. Not millions, thousands of other girls have had surgery with Dr. Hasan, and they are fine. And yes, he does have a death, and as unfortunate as that is, it happens, and I'm sorry, and I hope God rests her soul, and we are going to move on about that. Now, information about Vanity Cosmetics. So Dr. Hasan works with a company called Vanity Cosmetics. They do all his paperwork, they do all his client intake. They're basically like the administration for Dr. Hasan. So they have a lot of other doctors that work in their office. I'm sorry, I'm moving around because I'm sitting on a pillow and my butt is starting to hurt. So anyways, so Dr. Hasan works with Vanity Cosmetics. They also have a lot of other doctors that work with them. So they're like an intake office. They're like the administration. They're like what he uses to get his patients. So basically, there are a lot of bad reviews about Vanity Cosmetics because of prior incidents that have happened. I'm not going to go into them because they did not happen with me. If you want to hear about them, you can go on Real Self and you can research. But I had no problems with Vanity Cosmetics at all. They were great with me. The ladies were great. They are all of, you know, some kind of ethnic background, so a lot of the women speak Spanish, but a lot of them also speak English. So that would be the only thing that I would say would be a negative. I just wish more of them spoke better English to communicate better, but other than that, they are all beautiful, they're all sweet, and I had no issues with Vanity. My booking experience was great. I called and they let me know Dr. Hasan was having a special. His special was $5,300 cash price, and you would have to make a $1,000 deposit in order to hold that cash price and also hold your date. How you do your deposits or how you make your payments if you're not in Florida is through a cash wire transfer via their Bank of America account. Make sure that you hold on to your receipts because you will need to take a picture and email a picture to your coordinator to get invoices. So a lot of people ask me, you know, don't you find that's kind of weird that you have to transfer money to them? Honestly, how else would you get them the money? I mean, you want to pay over the phone with your credit card information, you want to give them your credit card information. To me, that's, you know, a little bit more, you know, weird to me. I'd rather pay cash to a bank and have receipts from the bank that it was paid. So it's not odd to me. A lot of people ask me, is it real? It is real. I did the Bank of America wire transfer to Vanity Cosmetics, and you'll get all this information from your coordinator. So that was that. And also the $5,300 included your surgery. It included 2 massages at Vanity Cosmetics. It included your faja. It included 2 lipofoams, and yeah, and also you get a little triangle too for your back that you get, that's included in the price. So I'm just gonna talk about prep for surgery now that I am all ready to go with my surgery through Vanity Cosmetics. Booking your hotel, booking your flight, your body prep. So prepping for surgery, make sure that you book your hotel, make sure that you book your flight in advance so you could get really good rates. They tell you to stay in Miami for 7 days, so a week. I would say 1 day prior to surgery you need to be there, and then 7 days after. And also you want to make sure that you find a hotel that's close to the facility. So make sure that you're Googling that when you're booking your hotel. And also keep in mind, Miami is Miami. It's not like where I'm from, Sacramento, where there's only traffic during 8 and 5. Miami has traffic all the time. So make sure that if your hotel is only 15 minutes away, think that it's actually going to be 30 based on traffic. So make sure you take that into accountability as well. And also, let me show you some of the stuff that I have for pre-op. So they want you to take iron. So iron pills, I went and got Nature's Made iron pills. And then I also went and got iron with vitamin C. And then I also got Pure Absorb iron. So I was like, okay, I need to take iron to make sure that my hemo was up for surgery. So I went and bought as much iron products as I could, and I took all 3. That is a big no. More is not better in this case. Iron is good for your body, but taking excessive iron could be detrimental to your body as well. I started pooping black poop because I was taking way too much iron. So I would suggest only taking either one of these if this is what you can find. But my big recommendation would be Pure Absorb. It is this, 1 a day. It's apple flavored. It's great. It's a liquid. And it's iron in its natural state. So it's the healthiest on your stomach and on your body. You want to start taking that a month to 2 months prior to your surgery to build up your hemoglobin for your surgery. And so that is, and you want to make sure that you are stopped taking birth control, and you also stop taking any vitamin E or any aspirins that are like blood thinners. You don't want anything that's going to thin out your blood. So that is the prepping for surgery. And also, if you are under 150 pounds, I would highly suggest eating and gaining as much good fat as you can, especially if you want to see a big difference in your butt. Your doctor needs fat, obviously, to transfer. So if you are under 150 pounds, I would highly suggest getting to around 150 is the ideal weight for a BBL. And also, your doctor or your coordinator will request pictures, so make sure that you send those to your coordinator. And now we are going to move on to my pre-op day. I'm going to take a break because my back is hurting, and I'll be right back, guys. Okay guys, welcome back. So we are moving on to our pre-op day. So the day of pre-op, I got to Vanity Cosmetics the day before surgery. I did not get to meet Dr. Hasan the day before. You can in some cases, but in my case I did not, which I was totally fine with. So when I got to Vanity Cosmetics, they actually did some blood work. Prior to getting there, you want to make sure that you get your blood work done in your home state through your primary care physician. Vanity Cosmetics will send you a prescription with all the labs that you need to get done. You want to make sure that you get them done at least 1 month prior to your surgery. Anything further than 1 month will not work. So 1 month is the day that I got my labs done, got back all the lab work, everything was cleared for surgery. So when I got there, there was just one test that I had to do there that they had forgot to put on the prescription. So I did it there, and everything came back cleared for surgery. I then went into an office where I signed a bunch of paperwork just stating all the information, things like that. You already know, things that have to do with surgery. After I signed my paperwork, I then met with a lady that fitted me for my faja, which is a garment like this. So this kind of garment. This is not the garment that I was fitted for at Vanity. I don't know where the packaging is for that one, but that one, what they use, Diane, I believe, is the company or brand. So we fitted for that, and oh my gosh, it was so tight, but I was like, okay, I need it for compression. And also they give you ab boards. So, I mean, ab boards, foams. So this is a foam. They give you 2 with the price that you get. And I purchased another one for $20 because you want to make sure the whole body is compressed. So I have 1, 2, 3 all around my body, and they're about that thick. And this just adds extra compression in between your garment and your body. And then also you can purchase an ab board, which is this. So it's soft on this side and it's hard on this side, and this just keeps pressure on your abs and keeps your abs nice and straight and flat while you are healing. So this, I believe, was $20 or $40. You could purchase that there, or you could purchase that before online. And then also you get a triangle, which is this. And I have blood on mine because obviously I used it, and it's just for your back support. You don't get this the day of your pre-op. They actually put it on you after surgery, so you'll see this the day of surgery. What was I gonna say? So yeah, I got that stuff when I went to Vanity, and then they told me they would call me when they will call me with all my information for surgery. I didn't wait long at Vanity. I probably was there for max an hour, so that was great. The facility is beautiful, but that is not where you will be getting surgery with Dr. Hasan. Dr. Hasan's facility is maybe 15 or 20 minutes away from Vanity. So that is where I went the day of surgery. But before I talk about the day of surgery, I want to talk about surgery night. You want to make sure that you don't have any nails on, any nail polish, no fake acrylic nails. You want to make sure that you take a nice hot shower with antibacterial soap. You want to make sure that you don't have any jewelry, anything like that. Make sure you remove any lotions, any body perfumes. You want to be clean for surgery. Also, you want to make sure that you don't eat or drink any water or any food 8 hours prior to your surgery for anesthesia. So you want to make sure you follow those strict guidelines, and then you will be fine. The night before surgery was really hard for me. I was going through like emotional roller coaster. I was kind of just like, I don't know if I want to, you know, do this. I was nervous. I was scared. I was crying to my mom. I was like, I'm here, but I don't know if I want to be here. Am I making the right decision? So you'll go through that. You just need to kind of just not think about it and know that you're there and you believe in your decision, and get some good rest and try not to get too anxious. So the morning of surgery, you actually are going to go to the Palmetto Lake Surgical Center. It is about 5 minutes away from Palmetto Hospital. So a lot of people think that he does surgery outside of a hospital. It is not the hospital. The hospital is 5 minutes away. He performs surgery at a surgical center. So when I got there, my surgery was set for 5:30 a.m. I got there promptly at 5:30. I was greeted by his nurse assistant, where we did a pregnancy test. We did some pictures, and they checked my blood pressure, signed some paperwork, and then Dr. Hasan came in, and I met with Dr. Hasan. Mind you, Dr. Hasan only does a maximum of 3 surgeries a day, unlike a lot of doctors that do 6, 7, 8 procedures a day. He only does 3. I was his first and only surgery of the day, so I got all my doctor's attention, which I loved and was super, super grateful for. So I saw him around 6 a.m. He came in. He was a very, very good looking man. He's tall, in shape. He looks nothing like his real self picture, which I'll put up. He came in, he was like, good morning, what's your name, where are you from? I found out that he is from San Francisco, so that is great. And then we got down to the nitty gritty. He looked at my body and he said, wow, you know, for having 2 kids, you don't have any of those stretch marks. You have really great skin elasticity. You do have great fat for this procedure. And he asked me how big I wanted to go with my butt. I told him I didn't. My main concern wasn't my butt. I told him I didn't want anything that was too big. I wanted it to be something that I could live with forever. With being a mother of 2, I didn't want to draw too much attention to this big, you know, video girl butt. I just want something that fit my body. But I did tell him I wanted the smallest waist possible. I told him to take every inch of fat off my stomach he could. I told him, get rid of it. I don't want it. I don't want it. And he was like, totally understandable. He was like, I know how to shape your body perfectly. He went in with the marker and started drawing on my skin where exactly he thought. And he told me all the risks and things that were associated with this surgery. He let me know everything. He didn't sugarcoat it for me. But he also did tell me that being of African American descent, that our skin is great for elasticity, meaning when he removes the fat, there's muscle, there's fat, and then there's the skin. When you remove the fat, the skin and the muscle have not met in such a long time that a lot of people get a lot of loose, hangy skin. But of being African American descent, now this is from my doctor, he let me know that our skin elasticity is more likely to stick back. So that was something good that I really, really enjoyed to hear. He listened to what I wanted. He told me what was realistic, so I felt very, very comfortable with him. Just make sure you use this time to let your doctor know exactly what you want, and you also listen to your doctor and what he's saying. This is your communication time with your doctor, and I really did feel that he listened to me. I felt comfortable with him. I did not feel rushed. We laughed, we had a good time, and he said, all right girl, let's go do this. So I went into the OR room. It was super cold. I had a drape on, I had my compression socks on, and I had a hair cap on. And when I walked into that OR, I was shivering. It was so cold, and it only got worse when the nurse started wiping me down with the brown cleanser. So I was like shaky, shaky, shaking. They cleaned me up. I got on top of the table. And I was laying on top of the table. He had 2 nurses in there, and then the anesthesiologist walked in. I believe his name was Michael. He was a very young, good-looking guy. I was like, damn, you know? But he came in, he said, hi, my name is such and such. Do you have any allergies to, you know, any foods, medication, anything like that? He asked me if I had ate anytime soon. He asked me if I had any loose teeth. You know, he was just asking me questions, and then he let me know that he was gonna start my IV, which he started in my hand. He actually was hitting my hand with like this little rubber hammer. That kind of hurt, and then he did put the IV in. He let me know that he was going to administer the actual medication, but before he did that, he wanted me to know that this medicine did burn, so it would have a burning sensation and I would taste it. So as he was administering that medicine, he told me to look back, open up my mouth. He checked my mouth, and then after that he told me to think of a happy thought, and I thought of my daughter, and that was the last thing I remember. I was out, and it seemed like 2 minutes, but I was up again. So I don't remember anything in surgery except for Dr. Hasan being in there with his nurses and the anesthesiologist and being in a cold room. I don't remember anything. I didn't feel anything. I just woke up in the nursing bed face down. Waking up from surgery is the worst part of surgery. This is going to be the worst time in your surgery journey. Waking up from surgery is basically like waking up in an ice bath. You are so cold. You're uncontrollably cold. You're out of it. You don't know where you are. You're shaking. I had to pee, so I'm like face down looking around. I'm hearing all these voices. I need to pee. I'm cold. I'm in my faja. I'm like wet. It was just like one of those experiences that like literally you've been kidnapped and you woke up in like a Saw movie or something. So I just remember letting the nurse know that I needed to pee. She told me, okay, I'm gonna need you to use your arms to prop yourself up, like basically like doggy style. So I used my arms, and I just remember not really feeling much, but I know that it was super hard to get the strength to push myself up. But I had to pee so bad, and I did not want to pee on myself. So I pushed myself up, and she shoved a little pan tray right underneath, and I just remember going. So after I went pee, I dropped back down, and I was just like so drained from just getting up like that. I also asked the nurse, I was like, how do I look? And she's like, you look great, girl. You look amazing. But she did want me to try to get back up to drink some Gatorade, and she wanted me to keep, you know, talking with them. She didn't want me to go back to sleep, because once you're up, you want to kind of try to get all the way up. You don't want to be in between anesthesia. So that was probably the worst experience, was waking up. But the nurses there were great. I woke up and I saw Dr. Hasan. He was there waiting. He didn't do my surgery and bounce. He waited till I was fully up. He talked to me. He let me know surgery went great. He told me I did have some stubborn fat, but he did get the fat. He told me I look great, and he said the only time he ever wants to see me sitting down in the next 6 weeks was in the wheelchair being pushed out to the car. And other than that, he thanked me and he left. So it was amazing to see that my doctor stayed. Not a lot of doctors do that, and it just made me feel very grateful that he really cared about me. I did not ask him how many cc's he put in each cheek. I didn't care. I know a lot of you girls keep asking, you know, how many cc's, how many cc's. I don't know. I can probably call and get the number, but honestly, it's all about how you feel and how you look. To me, it's not about the cc's, the amount. They're not really like boobs to me. And it's especially since the butt wasn't really my big issue. I did not ask. They wheelchaired you out into your car on a towel. So think about a towel being like this. You just roll up the towel like this, and you put it right behind your knees. So like your knee is like that, and you put it right there. So you're propped up on your thighs instead of sitting flat on your butt. They wheeled me out, and I was off to the hotel. You want to make sure that you have these pads. They're called Chucks. They fold out. They just look like doggy sheets, but you want to make sure that you bring these with you to anywhere, all your appointments after surgery, because when you get into the car and you lay down, you're going to be leaking, you're going to be draining, you're going to be having blood and fluid, and you don't want to get that on anyone's car. So make sure you pack these with you. These are great for the hotel and beds and everything else. Okay, so before I get into like getting to my hotel and things like that, you actually leave with some information. So your doctor gives you this information right here. There's 2 sheets, and it kind of is just surgical patient discharge planning summary. So it just tells you like what you cannot do, gives you some information on that. I'm gonna scoot this back and then zoom in my actual face. Perfect. So it just gives you some information, and then also your prescription. So on our way to the hotel, my niece, who was my nurse that took care of me, she went to Walgreens drive-thru and had our driver pick up my medicine. I got 2 medicines prescribed, one for pain and one for infection, so an antibiotic. I was prescribed Percocet and then sulflexilin. So Percocet is supposed to be taken 1 or 2 tablets by the mouth every 4 to 6 hours depending on the pain, and then your antibiotic is to be taken every 8 hours. So with the Percocet, I was prescribed 30. There was only 2 times that I actually took more than 1 at one time, and that was just because I think it was more more my mind saying I was in pain than it was actually my body in pain. But 1 Percocet does do the trick. Be very, very careful with these medicines because taking pain medicine and antibiotics really does mess with your body, and it does cause constipation. So I didn't have my first bowel movement for 10 days after surgery, which is really, really unhealthy. I actually purchased Phillips capsules to help with that. I didn't take them because I just was stubborn, but you do need to use these 5 days after surgery if you haven't had a bowel movement yet. So those are the medicines. Also, after surgery you want to get some form of arnica. This is arnica gel, and this is for muscle pain and stiffness, swelling from injuries, bruising. So these are for bruising. You could rub this on, or also you could take the tablets. But what I found helped the most was actually my arnica tea. So this is a tea that you just steep and you drink. You can drink it in the morning and at night, or just once. You want to be very, very careful with arnica because arnica does create headaches. So you do get headaches when you take a lot of arnica, so be careful because it helps you pee and it helps you get rid of all the fluids that are flowing in your body after surgery. So you're urinating out a lot of your nutrients, causing you to potentially get headaches. So these are some good things to have. And then also after surgery I started taking collagen. This is just 1 scoop. You pop it into your orange juice or whatever you like to drink. It's best with vitamin C, so orange juice is the best thing to take it with. And this helps promote skin elasticity, so increase the hydration and the look of skin appearance. So this is going to help your skin look the best after liposuction. So this is a great, great thing to have, and I picked this up at my local like Walgreens, CVS. So going back to my hotel was fine. I didn't have any issues. I went right to sleep, took my medicine and went right to sleep. I woke up to eat and drink lots of water and Gatorade. You want to stay hydrated. That really, really helps with the recovery process. And getting up to walk and use the restroom is key too, to help the blood flow. You can't sit and use the potty, so like literally my #1 thing that I had for my BBL journey was this. This is my female urinal. Literally I still hold this thing with me everywhere I go because you can't sit. And we're not like a guy where we have like an actual shooting thing where we can aim and shoot into the toilet. Like even if you squat to pee, it still, I feel like it drips down your leg or runs everywhere. This thing, you just put it right underneath your vagina and it just cups it and you pee right into it and you don't have to sit. So I bring this with me when I go out to the store or wherever, because you never know when you're going to need to use the bathroom. So this is my #1 thing to have. This is a lifesaver, a female urinal. So I'm actually going to scoot this back yet again. Perfect. Okay, and so walking, drinking, eating, all of that are great to your recovery. And making sure that you're taking your medicine, your antibiotics, so you don't get any infections. Also, my doctor does not use drains. Some doctors use drains, some doctors don't. He just left my incisions open so I can drain naturally. So having those puppy dog pad things are great so you don't mess up the hotel room bed or wherever you're staying. There's a long list of things that you might need post-op, like band-aids, Neosporin, and some of the things that I went over, but I'll put that in the description box. And then also traveling with someone versus traveling alone. I traveled with my niece, who was my nurse, so I was able to stay in a hotel because she can bring me my food, she could watch after me, she could help me if anything went wrong, someone I trusted. But some people don't have that luxury to be able to travel with somebody, which is totally fine. But I do suggest staying in a recovery home if you are traveling alone. They have options for that, where you actually get a driver that picks you up from your surgery, takes you to all your appointments. They have a chef that prepares you meals, and they also have 24-hour on-call nurses and nurses on the site to take care of you. So that is something that I would definitely look into if you're traveling alone. Never travel alone and try to recover on your own, because you never know if something can happen. There's a lot of risks with this surgery, especially since you're losing so much blood, so much fluid, so many things like that. In the state of Florida, my doctor let me know that there was a 4-liter law. So by law in Florida, at one time during liposuction, they are only allowed to take out 4,000 cc's. So that equates to between 10 and 15 pounds of fat they are only allowed to remove. When your body shifts so much fat and mass all at once, it causes a lot of pressure on your heart, on your lungs, and things like that, because your body is losing a lot of things and a lot of nutrients that it's used to having to survive and to operate. So that's why they have that law. When you do this surgery, you are at risk and susceptible to blood clots, to embolisms, a lot of things that are life-threatening. If you do not take precautions and keep your compression socks on, making sure that you're walking every couple of hours and you're not just laying flat for 24 hours straight. Your body can create a blood clot, because after being under anesthesia for so long and your blood shifting, your blood is very sticky and your blood is very thick. So if you're laying flat, you're creating clots, and you don't want to create a blood clot and let it travel to your heart or your lungs, because that's when you get embolisms and you can die, obviously, from those things. So you have to force yourself to walk, you have to force yourself to drink, and you have to force yourself to eat, and also taking your medications. You have to do these things in order to have a safe recovery. Also making sure that you're keeping your faja garment on and not taking it off for 24 hours. You are not allowed to shower after your surgery for 24 hours, so you must keep your faja on. And also your faja should have a little slit or a zipper in the crotch area, allowing you to use the restroom, so you don't have to take your garment on and off. So making sure you're traveling with somebody or with staying at a recovery home. The next day I actually went to have a massage. I didn't utilize my Vanity Cosmetics massages just yet, because I actually did some research on a massage therapist named Miriam at Medical Massage Specialist, or I'm sorry, I'll look it up and I'll tag, in Miami, Florida. And when I tell you, she is the best to get your post lymphatic drainage massage. You have to stop by her when you're in Miami. She was actually my first massage, and I hadn't showered, I hadn't taken off my garment. I literally woke up, hopped in my Uber, and went straight to her. It was $70 for an hour-long lymphatic drainage massage. We started off flat on the table. She massaged my back, which was very tender, very sore, very stiff. And through my incision, she was pushing out the fluid from the swelling. Then we stood up and she worked on my abs. When I tell you that after my massage, I felt like a new person. My shoulders were back. I was walking straight. I wasn't walking like crippled like I was going in. So I highly recommend her for your massages. In my time in Florida, I only had a total of 2 massages. Long story short being that I couldn't get to my other massages, but you want to have at least a massage every other day, if not every day. That really helps with the swelling, and that helps with the recovery, that helps with the skin, it helps with everything. Getting your lymphatic drainage massage is key, especially since Dr. Hasan doesn't use drains, and I'm going to tell you why. Because Dr. Hasan doesn't use drains, and like I said, you have your skin, you have your fat, you have your muscle. The fat has now been removed. You have skin and you have muscle. When your body is healing from liposuction, your body naturally pushes fluid in the areas trying to fill that space between the skin and the muscle, as basically like it's emergency, like we got to fill it, something's happened. It's like it's damage control. So your body fills up with fluid, causing swelling. That's your body's natural reaction to trauma. But if that fluid builds up in that area and stays, it is prone to infection, and it's prone to hardening, and you're going to get deformities on your skin. When you see a lot of girls that have really flat stomachs but they're lumpy, it's because they had fluid that was left and had hardened and capsulized. So that is what you're really susceptible if you don't get your massages, especially without drains. So what happened with me is I actually developed 2 seromas because I didn't have enough massages. And also my faja compression was not tight enough, keeping my skin and my muscles nice and tight. It was creating areas for fluid to push its way through and build. So I had 2 seromas that were on my hips, and before I left to fly home, my doctor actually drained them. How they drained them was with a needle and a syringe, and how much fluid they got out was 6 of these. This is 60 milliliters. So they got 6 of these worth of fluid out of my stomach. So that's how much fluid was building up because I didn't get enough massages. When I flew home, cabin pressure has a lot to do with fluid building up. You want to be very, very careful when you fly home not to sit on your butt. Only sit on your pillow during takeoff and landing when they tell you you have to be seated in your seatbelt. For the rest of the flight, you want to be standing up behind the bathroom or walking up and down the aisles. Luckily for me, I actually didn't have a full flight, and I got to sit on the back row and lay flat across the 3 seats. So that was great for me. But if you don't have that luxury, you want to make sure that you're not sitting, because you are very, very susceptible to blood clots in an airplane with all that cabin pressure and sitting right after surgery. So my flight experience was great. Make sure you have your boppy or your baby pillow or your BBL pillow to help reduce any pressure. And so my flight was just fine. Also, make sure that you don't get a flight that has stops. Make sure you get a non-stop flight just so you can just get there. Also in the airport, make sure that you request wheelchair assistance so you don't have to walk to your gate. They could help you with your bags and also help you get straight to your gate. So the flight experience was great. So just to touch on the seromas, since I did develop them, when I got home, they filled back up again, because that's what they do. Seromas, the fluid will come back. Even though my doctor drained it, it takes a little while for them to subside, and it does take a couple aspirations. Aspiration means the removal of something with a needle. So I called around to plastic surgeons out here, and either A, no one would touch me because they didn't do the surgery, or B, they were gonna charge $400 a session. And mind you, I aspirated fluid at least 8 times. So if I would have went to a plastic surgeon, it would have cost me close to $4,000. So I took it upon myself to find this, which is a syringe, a 60 milliliter syringe. And I purchased an 18 and a 20 gauge needle, 1.5 inches. So 1.5 inches long and 18 and 20 gauge round thickness. And I purchased these at my local pet supply feed store, so like a horse store. I know that sounds crazy, but in the state of California, you are not allowed to purchase these size needles anywhere without a prescription. So I was desperate and I did it. I purchased them, and I actually used the 20 gauge needle, which is the smaller thickness one, and you just pop it right onto your, you want to make sure everything is clean, so using alcohol, disinfecting your hands, cleaning the area, making sure everything is clean, and you just pop the needle on. You just pop the needle on just like that, and there you go. So you have your needle, and then obviously the cap. So you have your needle and your syringe, and you want to clean the area of skin. So we'll say this is a seroma, a pocket of fat right here. You want to clean the area off. You want to either take a marker and mark out where it is. Say the hardness is right here and then the softness is right here. How you can tell a seroma is if you tap your skin and you get a wave-like motion. It's really, really soft. It feels like water and it waves. So you pinch that wave of fat, or of fluid, I'm sorry, not fat. You want to pinch that, and then you want to take your syringe with the actual sharp side pointing downwards, and you just want to puncture that seroma. You just want to puncture it, and don't go too far deep. You just want to get into that pocket, and then you start to pull the fluid out, and you compress the seroma to make sure all the fluid gets out. I wish I would have did one where I was actually draining it myself, because I don't want to give anyone the wrong information, because this is dangerous. You can get an infection. I am not a nurse, but I mean, I really didn't have any other options, and it worked just fine for me. I did it about 8 times, and each time I would get a full syringe of fluid. I have pictures of that, or sometimes I would get 2, and it worked just fine for me. It did not hurt because your skin is numb. And I did not get any infections, thank God. I was very clean and sterile, and it worked just fine for me. But if you do have the money, definitely go to a plastic surgeon. Just know you will have to get it aspirated multiple times. Like I said, I did it 8 times myself, and I also had my surgeon do it in Miami. So a total durations. And also making sure that you are getting your massages and keeping tight compression with wearing your garment, wearing your foams, and making sure your compression in your garment is not too big will really help you not develop seromas. So I hope that was helpful, that part. I wish I would have did an actual real life demo on how to drain a seroma, because I know it sounds crazy, but it honestly was very, very easy for me to do it. And I'm sure there's other videos on YouTube. So you want to make sure that you are keeping that garment on. The faja is very, very important to keep on. You should be wearing your garment at least 23 hours of the day, only taking it off to shower or to wash it. I have a total of 3 fajas, so I rotate them to make sure that I'm always in compression, so I do not swell up, and so that my skin does tighten back up. And it just really, really helps with the recovery process. You should be wearing your foams with your ab board with your faja for the first 6 weeks, and you also should not be sitting down on your butt for 6 weeks. They say you can sit at 3 weeks on a pillow, but I would not even do that, because that is how your fat cells in your butt die, and they reabsorb into the skin. So that's how your butt does get smaller, and the fat does not have a higher chance to survive. So stay off your butt for 6 weeks and keep your compression garment on, and making sure that you're showering with antibacterial soap, cleaning your incisions, and also making sure that your skin is hydrated with lotions, because your skin does get dry and then it starts to get itchy. So you want to make sure that you're lotioning your skin, putting on your Neosporin, and on your incisions. And your incisions should close up within a week or 2, depending on Hi. Okay, thank you, Mama. You're on the camera. Thank you. So they should close up within a week or two depending on how you're draining. And so I am at 4 weeks today. No, I'm at 4 weeks right now. I have 2 more weeks to go for my 6-week mark. And honestly, I definitely would do this BBL again if I needed to. It was a great experience. If you do want to do this, it really wasn't a nightmare. A lot of people think that it is. It was fairly easy. The biggest part about having a BBL is the mental note. The mental, so honestly, the worst part, I don't want to say the worst part, but the biggest part about prepping yourself for a BBL is all mental. It's a mental preparation, especially coming home knowing that you can't sit, you can't drive, you have to lay flat on your stomach. It's all mental. That was the worst part for me. I'm so used to getting up and driving to the mall or driving to get some food. You can't do that. You either have to catch an Uber and lay flat in the back and explain to them, or you have to have someone wait on you hand and foot. You can't go out. You want to show off your body, but you can't. You have to take care of yourself. You can't eat salty foods because that's how you retain water and have more swelling. It's just so much, and you have to stay on it for the best results. So it's all a mental preparation. But would I do it again? Yes. I love my doctor. I recommend Dr. Hasan, Anthony Hasan, to anyone. He's an amazing doctor, and it was just an amazing experience for me. And I'm so happy that I got to make this for you guys. I hope you guys enjoy this, and make sure you keep your faja on, make sure you don't sit on your butt, and make sure you like your results for yourself. At the end, you can start to get a thing called booty greed, where you look at your butt and you're like, oh, I want it a little bigger. Love yourself for what your results that you have, and don't keep comparing yourself to other people, because then you're gonna keep this cycle up. I kind of went through it a little bit. I was like, oh, you know, well, my booty's not that big, but you know what, my body looks great for me. And let me stand up. Hey, my little tiny waist, and let me see if it will show you my incision. Here is one of my incisions right here. I have one here, here, and here. Oh, there's the other one sneaking out, and that's the only ones that I have up front. I have some on my back. Let me turn for you guys. I have one right here, but that's my booty. Let me see, I have another one up here somewhere, and I have a few more, but they'll start to diminish with time. And so that is my BBL journey. I hope you guys enjoyed it, because it was a lot to tape this video. I think I've taped it like 6 times, and I just wanted to get it perfect for you guys. If you have any questions, do not hesitate to ask. I am here for the cause, and I am not selfish at all. Just make sure that if this is something that you want to do, you do it for yourself and you do your research. Don't go to someone's doctor just because of their results. Make sure you do your research and you do what's comfortable for yourself. So thank you guys so much for tuning in. I hope this video wasn't too long for you guys. I hope I didn't miss out anything, and if I did, please ask. Thank you. Bye guys.